In this presentation, myself, Dr. James Faulkner, and my colleague Helen Ryan-Stewart will introduce staff at HHFT to some of the physiological testing equipment that we have for research purposes in the School of Sport, Health and Community at the University of Winchester. In our physiology laboratory, we have various pieces of equipment that allows us to undertake exercise tests. We have research-specific treadmills and cyclogometers. We have equipment that allows us to monitor respiratory parameters both during static and dynamic exercise. So we have a cortex metallizer, which is in a number of the images on this slide, which allows us to monitor respiratory parameters such as oxygen uptake, carbon dioxide production, minute ventilation, and gives an indication of metabolism at different exercise intensities and stages. We can conduct both submaximal and maximal exercise tests, and we have the capability to undertake exercise testing across a wide range of different population groups, from pediatric groups through to various clinical groups. So just to give you an example, we've conducted various exercise tests with some of these physiological pieces of equipment with patients with Crohn's disease, stroke patients, cardiac patients in recent years. Our laboratory also has the capability to undertake quite extensive vascular assessments. So we have a Sigma Core Excel and a Vicorder, which allows us to look at parameters such as pulse wave analysis, which can capture measures of both central and peripheral blood pressures, and also augmentation index, which is an indication of arterial stiffness. We also have the capability to look at pulse wave velocity, so basically how fast blood flow can travel through the body, as a non-invasive measure, and we can do that in both the upper and lower limb, and obviously we can apply that to different population groups. So in some neurological populations, we can look at both symptomatic and asymptomatic limbs with regards to these parameters. We have recently acquired a number of gene-active monitors. So these are basically activity monitors, which allow us to objectively assess or monitor physical activity, sleep, and everyday living behaviours. Again, this has huge potential in terms of being applied to paediatric and various clinical groups, whether it could be implemented within a hospital setting or following discharge and once people return back to their home or to the community. So again, a piece of equipment that has real potential in terms of looking at lifestyle and physical activity behaviours.
So one of the other bits of kit that we use relatively regularly in our research in our laboratory is a NIRS, or a near infrared spectroscopy. We have two of these probes that you can see in the picture on this slide, and what these allow us to do is to get an idea of what's happening in terms of blood flow, both at the muscle and within the brain, so in the cerebral tissue. And it gives you various different outcome measures. So it gives you an indication of what's happening in terms of oxyhemoglobin, deoxyhemoglobin, total hemoglobin, and tissue saturation index, or TSI. And we have used these fairly regularly to look at various different aspects of what's happening both at the muscle and in the cerebral tissue at rest and during dynamic and exhaustive exercises as well. And obviously this has the potential to be applied across a range of different participant groups in the clinical setting, and to look at what's happening both in terms of blood flow to the cerebral tissue, but also blood flow to the muscles. We also have in our laboratory a USmart 3300 ultrasound device, and we've used this for various applications in our research studies. So one of the main things that it has been used for is to look at vascular parameters using the M mode of the device. So having a look at vascular health in terms of arterial stiffness and blood velocity, and then thinking about how that associates with risks for comorbidities, and how exercise interventions can help improve some of those measured parameters. And the other thing that it's been used for is looking at measures of muscle architecture, in particular muscle size, and how muscles change in response to exercise in various different populations, so both in clinical and in healthy normal populations as well. The final thing that I wish to introduce to you today is the fact that we have significant expertise in body composition measurement in the form of anthropometric measurements. We have lots of different types of equipment in our lab that enable us to measure people's anthropometry, and we also have significant expertise in this area, both from a knowledge perspective and an application perspective. And this allows us to measure various different aspects of physique, from skin folds and circumferences right through to limb lengths and bone breadths in various different population groups, from both from a sporting context right through to the clinical groups as well. We also have the ability to train people in these anthropometric measures to ensure that they are taking quality measures on a regular basis. And we've recently developed an online short course for those working in the paediatric population group, so that they can ensure they have a quality assurance process in place.